we're just a few moments away from our standing ovation. I want to thank you all for being here tonight. Obviously, everyone back here for being here tonight. It's hard to believe, but it's been 2 years since the pandemic came to San Diego, and that day that kind of changed the world. It probably feels like much more to many of us, but it's been 2. And I remember very clearly the uncertainty, the fear, and the worry about the health of the community and our society. One group of people stood ready to help despite the risk of their lives, the risk of their families, and the challenges of healing people from the novel coronavirus. We've had multiple surges. We've lost way too many good people along the way. But through it all, these people here behind me, some of the people here in the audience, and so many more who aren't here, deserve to be thanked. So, with that, as we close in on 6:30, we're going to ask everyone to stand up for a standing ovation. We'll count down to the beginning after 6:30 and give a 1-minute moment of appreciation for all of our help. 9, 8, 7, 6, 5, 4, 3, 2, 1. I'm actually thinking about an exercise that I had to participate in a couple years ago in a leadership training where they made us sit and receive applause. I know it's uncomfortable sometimes, but the lesson there was you deserve praise. And if those of us in that little leadership program deserve it, you certainly do. And then some. So thank you so much. I want you to know that we recognize that you kept working. You're still working despite the trauma of seeing so many sick people, despite the exhaustion, despite the many other challenges, and knowing that you're still here for us means the world to us. So thank you. And so with that, I want to make sure that everyone has an opportunity to individually recognize the folks who are up here with us. So when I call out your organization, please stand up and be recognized. And we will start with Alvarado Hospital Medical Center. San Diego. council discussed earlier this week, something that we haven't done enough since those early weeks of the pandemic was express appreciation and gratitude. And so obviously we're doing this here tonight, and I hope all of us can keep that mentality of gratitude and appreciation in mind, and make sure that we share that with our healthcare workers on a daily basis. We admire their hard work, dedication, saving lives, and we are so grateful for their service. With that, now I'd like to invite Mayor Todd Gordon into the podium. Thank you so much, Council President, and good evening, everyone. Welcome to our city's crown jewel of Balboa Park. It's the Woodford District. I want to acknowledge Council President, thank you so much for creating this event and bringing our city together to mark the historic contribution of this important part of our city. Recognizing that the last 2 years have been tough seems like an understatement. All right? Yeah. I mean, and many of us want to move past this as quickly as we possibly can, and I got myself among them. But we do need to pause and thank those who helped get us to this point where we can come together as a community, where we don't have to wear masks if we don't want to, where many, many, many of us have been vaccinated. And everyone who has done that, thank you, thank you, thank you for getting vaccinated, thank you for getting boosted, thank you for creating the opportunity for us to get back to some semblance of normalcy. But it is right to pause tonight to acknowledge our healthcare heroes, to recognize that even as we emerge from this pandemic, or hope seemingly are emerging from it, we know that many aspects of our lives and our culture will never be the same. And I can tell you, as someone who has the privilege of being able to go about our great city, the 1.4 million people who call our city home, I know that all corners of our city have been touched by this pandemic. And I want to be honest with you, truthfully, I found it extremely difficult to be the mayor of a major American city during this pandemic. And while the disruption of most people's lives pales in comparison to what our healthcare heroes have done for 2 solid years, it's an extraordinary sacrifice of long, stressful hours, staffing shortages, the emotional toll of caring for so many patients that were so deeply sick and in too many cases dying, being separated from your own families. While so many others were sheltering at home, you had to bravely go out into the world back when we knew very little about the virus. And yet you did that work. You did it honorably, but you did it during the most brutal of times. So despite the often sobering statistics of case rates, hospitalizations, ICU levels, and of course, most tragically, deaths, here's what I want to remind all San Diegans, the 5,000 members of our community, our local community, who we have lost in the pandemic. Despite all of those horrible things, each of these healthcare heroes has held fast. You've endured all these challenges, putting your own needs on the back burner for 2 years, and having come back the next day to do it all over again, over and over and over again. This evening tonight is important, but it's incapable of adequately expressing gratitude for your strength, for your resiliency, for what you have shown all of us during this crisis. But I can tell you, unequivocally, sincerely, and are forever indebted to you, to your families, who sacrificed to get us to the point where we are today, with a bright future ahead of us, knowing that we can now start focusing on the major issues facing our city of homelessness, of housing affordability, of infrastructure. We couldn't do that when our focus was on the pandemic, necessarily so. You have helped make this possible. So on behalf of a grateful city, I want to express this city's gratitude to our healthcare heroes and the families who are in the audience. If you're a family member, please stand up, be acknowledged. We want to thank you for supporting our heroes. Before I turn it over to the next speaker, who I'm delighted to introduce, I will take a point of personal privilege. You all know that in our city, the mayor is the city manager, which means that I get to lead our 11,000-person workforce. People who also have sacrificed and went out to the community every single day during the pandemic, making sure that water was on, the garbage got picked up. This is often thankless task made even more difficult during the pandemic. We already acknowledge some of our city employees. There are some in the audience as well. Would our city employees please stand up and be acknowledged for their contribution? city family, as the mayor of this great city, I thank you for what you've done. You are also a part of our healthcare heroes. With that, let me tell you, our healthcare hero-in-chief at City Hall is this next speaker. She's our city council member representing District 2. I'd like to introduce this former healthcare worker, Dr. Jennifer Campbell.
Hi. Good evening. I am so glad that we are all here and that you have come to be with us tonight. We want to recognize the heroic sacrifices our healthcare professionals make each day, especially during this COVID-19 pandemic for the last 2 years. As a physician with many decades, it is my honor to speak this evening about the doctors who did not hesitate to step up in our time of need. I want to share with you what a reporter asked me when I and my colleague, Councilmember Chris Cate, and several physicians from our county health department opened the monoclonal antibody center in Claremont. This occurred several months after vaccines were readily available, and some citizens had not taken advantage of immunizations. The reporter asked, quote, "How are you doctors feeling toward those who refuse vaccines and then they get sick? Are you angry and resentful of them?" And so I said, "No, of course not." All of the doctors agreed with me who were there, and I'm sure all the doctors in the world agree with me, because we are professionals, highly trained. We want to help patients and save lives. We always take care of those who are ill with empathy and compassion. This is our privilege. This is our calling. This is our duty. Of course, we want to prevent disease whenever possible. Vaccines are one of the great advancements in science that have made it possible to save millions of lives, such as from diseases like smallpox, measles, mumps, rubella, diphtheria, tetanus, chickenpox, polio, hepatitis, and now COVID, and many other diseases. No matter the individual person who is ill, we always treat them with sympathy and care because we are doctors. Our San Diego doctors make these trying times with heroism and grace, with their strong work ethic and sense of caring, putting others before themselves. I am grateful that I was able to administer vaccines alongside many of our healthcare heroes, including our fire chief and our fire rescue department. I am grateful to both of our mayors that I served under, who asked for and listened to my public health advice, knowing that I practiced and taught medicine for many years before coming to City Council. As the co-chair of the COVID-19 response recovery committee, along with my dear colleague, Councilmember Alvarado, closely with the county, I saw firsthand the amazing work being done by our healthcare providers to combat COVID-19, the most infectious and life-threatening public health menace that we have ever faced. I want to give a shout out to Dr. Jennifer Tudor, officer. She has come every month to our committee on COVID at council and helped to educate us and the public what's going on, what the next steps should be, how to stay safe, how to be safe, and how to make our safety safe. Thank you, Dr. Taylor. These hero physicians work day and night to protect the health of their patients, adapting to meet the growing healthcare needs of our city, and spending long hours away from their loved ones whom we also thank. To all our healthcare workers, from our hearts to yours, we appreciate your hard work, and we thank you for all that you have done and continue to do, and for your courage and your selflessness. Thank you. And now I'd like to introduce my friend and my dear colleague, District 1, Councilmember Joe DeCarlo.
Thank you, Dr. Campbell. Well, I have the distinct honor and privilege to say a few words about our nurses. So I wasn't really sure because I didn't see, are there any nurses in the house? These past 2 years, nurses have been doing the impossible. They've been running a marathon at a sprinter's pace. And they have been doing so much with severe shortages in staffing, equipment, protective gear, and resources. With 44,000 unfilled positions nationwide, nurses are doing more than their fair share, taking extended or even extra shifts in order to keep us healthy. And while this past 2 years have challenged us all, the level of personal and professional sacrifice nurses have made serving individual needs and the public's health is unparalleled. From the initial shutdown through the vaccinations and surging variants, nurses have been here for all of us, working long hours, quarantining on their time off, missing family time and personal events, all for our safety. As we emerge, we hopefully are emerging from the pandemic. It may not be over yet. Reflect on COVID-19. We must never forget the compassion, dedication, and professionalism by nurses during this unprecedented time. Nurses have done, are doing, and will continue to do their job. Becoming a healthcare hero was not a choice for them, it was a necessity. Now it is our turn to step up and make sure we take care of them as they have us. Tonight is a small token of our collective appreciation. Thank you to our San Diego nurses for being a symbol of strength and dedication. We quite literally owe you our lives. Thank you. Now, to celebrate our first responders, the esteemed council member from District 7, Raul Campillo.
Good evening, everyone. Thank you, Councilmember LaCava. In normal times, a police officer will run towards the gunshots. A firefighter will run towards the fire. A lifeguard will dive into the waves, not knowing what's behind the door when they're responding to someone who they know is in harm's way. Well, the last 2 years, they've been doing all of that while also knowing that there's a chance they might have to provide CPR, help someone with broken bones, transport someone to the hospital, be there to save lives, and now they had this invisible battle to face as well. I'm so honored to be able to acknowledge our city employees, the San Diego Police Department, San Diego Fire Rescue Department, and I also want to call attention to the civilian supporters who are not peace officers or firefighters or EMTs or lifeguards, who all along have been there to support and make sure that we protect those who are in harm's way, who didn't have the medical training, who at the very beginning were wondering, what exactly am I running to right now? And they did it without any questions asked. So the police officers, the firefighters, the lifeguards, the EMTs, and their family members, please stand up for an applause. They are among our most honorable city employees, and I'm honored to be able to advocate for their needs at City Council with my council colleagues in Aaron Gloria. Now it's my honor to turn the microphone over to the other co-chair of our COVID Response and Recovery Committee at City Council from District 5, Councilmember Monty Grunwald.
This is the Peoria Council District Peoria, and I'd love to introduce you to Hooker.
Councilmember Campillo and Wilford, good evening, everybody. Great to have you all here. Welcome to Council District 3. I know it's a little chilly tonight, so thank you for braving our harsh San Diego winter weather here for good cause. I want to thank our Council President, Miguel Rivera, for coordinating us tonight. I want to thank our mayor for his leadership during the last year plus of this pandemic. And I am so privileged to serve with this group of council colleagues. And like them, I too want to echo the sentiments of my colleagues in thanking all of the healthcare heroes who have gotten us through the hardest days of the pandemic. And in particular, I want to recognize the hundreds of workers and community volunteers who have given of their time to serve at vaccination clinics all around the county. When those sites first opened, as you will recall, the staff and volunteers at the vaccination clinics worked around the clock to ensure that all San Diegans had access to the vaccines, even when the lines were long and the frustrations were high. And here in District 3, one of the first vaccination clinics that opened was at Petco Park, and that was managed by UC San Diego Health, and we are grateful for that. Before closing, that site provided more than 200,000 immunizations in the 2 months that it was in operation. It was a magnificent feat. That site was a model of how to run a vaccine superstation. And I'm so grateful to everybody who worked to get that site up and running. Our San Diego firefighters also gave of their time to provide vaccinations here in Balboa Park, at the municipal gym, and elsewhere around the city. Many of them worked overtime. They gave up time with their family and their friends to ensure that our community stayed healthy, something they do every day and took it even to the next level through the pandemic. A number of community organizations also stepped up and partnered with healthcare providers to host vaccine clinics at their sites, oftentimes working to reach populations who was very difficult to reach otherwise. Several churches, community centers, advocacy organizations, and more have given of their time and their space to host vaccination clinics, and we are so appreciative of that and that effort as well. San Diego's population eligible for the COVID-19 vaccine has been over 80% vaccinated, and that has helped us to be a healthier city and to save countless lives. We've been able to get back to the sense of normalcy that we have today, thanks to the vaccine, and we would not have been able to get here were it not for the help of our healthcare heroes who have given up their time to provide those shots. So to everybody who has made our vaccine clinics a reality, we salute you. Thank you very much. And now it gives me pleasure to introduce my friend and council colleague, council member, Monica Macarista.
Okay, everybody, I'm gonna look at this paper. That's not what it says. And I would love to introduce the COVID-19 committee council member, Monty. Thank you, everyone. We have a fun musical series. We're not used to being in person. We're still on the Zoom. So this is really just part of the course. But thank you very much to Council President Pro Tem Montgomery Step for your help with the proclamation. My name is Marty Von Wilber. I am the co-chair with Dr. Campbell of the COVID-19 Response and Recovery Committee at City Hall. We want to thank Dr. Tudor, especially for your presence and the county's presence at our committee meetings. It is my great honor and pleasure to present this proclamation from the San Diego City Council to all the healthcare heroes who have gathered with us today. And every healthcare hero in San Diego, many of whom are still at hospitals and healthcare settings this very evening, for all you have done to save lives during this pandemic. Our city owes you a debt of gratitude for everything you've done on the front lines, through multiple surges of COVID-19, and for administering millions of life-saving vaccines. It is because of your strength and bravery that San Diego is in the recovery that we're in today. So the proclamation reads in part, whereas in March 2020, the first case of COVID-19 was announced in San Diego County, and strong measures were enacted to prevent the spread of the virus. And healthcare heroes treated patients with a novel coronavirus, putting their own lives and the lives of their families at risk. That was a really scary time for everybody. Back when the world first heard of the novel coronavirus coming out of Wuhan, China. And in our city, San Diego was one of the first cities in the country to respond. I want to tell a story tonight of one of our heroes we're honoring, who is Dr. Kevin Fox, an MD who is a hospitalist at UC San Diego Health. Dr. Fox was among the first healthcare workers on the scene when patients from Wuhan were first admitted into a dedicated isolated COVID-19 unit at UC San Diego Medical Center in Hillcrest after being transferred from MCAS. Dr. Fox shared his story on a Voices of the Pandemic podcast, where he stated, "I remember that night vividly," said Dr. Fox. "I was asked if I would be willing to take care of the patients coming from MCAS because we were not sure of the associated risk of this novel coronavirus at that point. And he thought to himself, I'm really young, I'm healthy, I live alone." So he said, "I quickly answered yes. It was definitely something I could volunteer to do." Although most of the original Wuhan patients' symptoms were mild, he spent considerable time at their bedsides alleviating their fears and uneasiness of being some of the first to have this disease. He ensured these patients and their families that the multidisciplinary teams were working around the clock to provide the highest quality of care, even though he couldn't physically touch them because they were still in hazmat suits at the time. Dr. Fox said the teams were all hands on deck as things evolved quickly during those initial days. And he said, "We were holding each other up through all of the exhaustion. We became like family during this time, and those strong relationships remain." So the proclamation also reads, "Whereas doctors, nurses, first responders, emergency medical technicians, and all healthcare professionals joined together to care for patients who were severely ill, scared, and isolated from their families, they offered them kindness, friendship, and comfort in their darkest hours." You know, to me, showing compassion is one of the true measures of a hero. And a beautiful example of this compassion comes from the Scripps Health Chula Vista ICU staff, as they created something during the pandemic called the Final Salute. I mean, this was the time when hospitals were overflowing and people were dying of this fatal disease, but nobody could be there in person. We didn't allow families in, so people were alone. And during this time, one of the efforts of two frontline nurse practitioners, Charlotte Thomas and Sarah Norton, was an effort to remember our nation's veterans. It was initiated to give veterans who passed away in the hospital of COVID-19 the honor of a military prayer, which they usually would get, but for the fact we did not allow our military personnel in at the time. So they wanted every veteran who passed away in the hospital to get the military prayer, a flag, and a final salute in the hallway by veterans who are healthcare workers. They wanted their families to know, who couldn't be in the hospital, that their loved ones was given this final tribute and this final salute as they passed. The final salute was actually spurred by a young veteran who died of COVID-19 in the Chula Vista ICU in the very beginning. One of many who passed when family could not be present. Now the team has taken the final salute and expanded it, so it is not just for victims of COVID, but to all patients who are veterans in the hospital. And finally, the proclamation reads, "Whereas healthcare heroes persevered through surge after surge of COVID-19 infections, hospitalizations, and deaths, despite the exhaustion, the trauma, and the heartache, they persisted in their work of returning patients to health." So now I would like to recognize a very special group of healthcare heroes who too often have not been given the recognition that they deserve. Our healthcare facilities and environmental services staff. We have here tonight. By one of colleagues at Scripps Health about the work of the facilities and environmental staff during the pandemic. She wrote, "The vast majority of the well-deserved recognition for heroics has gone to the frontline individuals who have gone above and beyond expectations for patients, and deservedly so. But the unsung heroes who have been in the environmental services and facility staff are the workers who are not as visible, yet still put their lives on the line to work for their patients first." She said, "Also, many of our environmental and facility employees take public transportation to get to work. It was extremely difficult for them to commute every day due to a reduction in the available transportation when the pandemic shut transportation down. They had to endure long lines, extended wait times, and reduced availability of transportation services. We view their roles as critical resources and functions for patient care. Without these environmental and facility superstars, patient care and outcomes would be far less than what we and our patients would expect. Lastly, many of our environmental services and facilities employees tend to come from some of the hardest hit areas of San Diego in terms of COVID exposure and case volume. In many situations, they live in large families, live together in a single house. Our environmental facilities employees had to remain healthy and unexposed to potential community spread events so they could remain healthy and continue to serve our patients. This meant that many of them had to remain secluded from their families during a very emotional and traumatic time. So as we look around for heroes, we do not have to look far, but we have to look a little harder because the average patient would not see or recognize them. But as the facilities environmental services team has continued to serve, patient places first and the self second. A hero, she wrote, is someone who places themselves before others, showing up because they know what they do has an impact, and they do their work with a passion. They did it because they cared for their neighbors, and they lived out the golden rule, to treat others how you would like to be treated. They did all of these things again and again and again without being mentioned in the newspaper, without being rewarded with food or candy. No pictures were taken, there was no fanfare. But each and every environmental facilities worker is a hero to me. So tonight we pay also tribute to you, to the hospital workers who cleans and sterilizes hospital rooms, to workers who greet people coming in for life-saving treatment, to the worker who feeds the patients and the staff, to the hospital workers who works with the dreaded families who are terrified for their patients, and every healthcare worker that has been dedicated to caring for others during this unprecedented time. And today, while we remember those we lost, we also remember all the lives that have been saved by every person here on this stage with me. Our hospitals are filled with caring hearts, and that's why we're proclaiming March 2022 Healthcare Heroes Month in San Diego. So on that note, I would like to invite to the stage with me Demetrius Alexiou, President and CEO of the Hospital Association of San Diego Imperial County. Now therefore be it proclaimed by the Council of the City of San Diego that this council, for on behalf of the people of San Diego, does hereby proclaim March 2022 to be Healthcare Heroes Month in the City of San Diego. I'm not even trying to introduce anybody because I clearly
So, thank you to the San Diego City Council, to our Council President, Hilo Rivera, Council Member Campbell, Council Member Von Wilbert, for bringing everyone together here tonight in honor and celebration of our healthcare heroes. Thank you also to our amazing mayor for his kind words and recognition this evening. I will say, the past 2 years, and we've heard a number of stories so far tonight, have tested our collective human spirit in ways that none of us could have ever imagined. We've seen the surges of COVID-19 patients, going up over 1,800 members of our community hospitalized in January of 2021. We've seen shortages of PPEs, we've seen shortages of testing supplies, shortages of vaccines and the push to get more vaccines out, and even the straining of our hospital capacity to the brink. Throughout it all, our healthcare system, and by that I don't mean any one of our hospitals, I mean our collective healthcare system, persevered. When there was a need for mass testing sites, our hospitals and the community came together and made it happen throughout the region. When we needed to distribute vaccines, we saw our first responders, our volunteers, and healthcare workers step up. And when we saw challenges for childcare, we saw our elected officials at the city and county level step up and provide that support to keep our healthcare heroes going. I'm so proud of our healthcare workers here in San Diego. Our doctors, nurses, pharmacists, allied health professionals, and first responders in our hospitals, our clinics, our FQHCs, and our community-based organizations stayed at the front lines and sacrificed so much, contributing to work even with so much uncertainty. Our Our community owes a tremendous debt of gratitude to every healthcare worker who put their own life at risk to care for those in need. And we've seen the outcome. Yes, we've lost lives, but we've saved many more. When lives were at stake, San Diego Healthcare's community was a shining example of collaboration and commitment for the common good. Thank you to our healthcare heroes, the people up on this stage, and their colleagues who are working tonight at our hospitals and healthcare facilities, saving lives and healing the sick. I think one thing is completely clear. Historically, you think of heroes wearing capes. We know firsthand that our heroes are wearing scrubs, lab coats, and they're working day and night to save lives. If one thing is clear through all of this, it is this. Our healthcare heroes will continue to be there for whatever challenges that we come upon as we move forward in the future. Thank you to our City Council for this recognition, and thank you to all of you for being here tonight.
Good evening, everyone. What a wonderful evening. I want to start by thanking the Council President, Rivera, for organizing this event and extending the invitation to all of us. It's an honor to be here this evening as we celebrate a wonderful occasion to recognize each of you as a hero in our communities. As we close this ceremony, I would like to echo the sentiment of every single voice that you have heard and has taken the stage today. Thank you. That you have all done for our patients and people in need. This pandemic has been a roller coaster of highs, lows, loops, and turns, and you have been there every step of the way. But it's my honor to be here with you this evening to highlight your unparalleled sacrifices that each one of you have made as you have served our communities. Whether you are providing COVID-19 vaccines to patients, working on the front lines of deepening the throes of uncertainty, or assisting in reopening clinics for patients to catch up on preventative measures in person, the sacrifices that you have made are not overlooked. I know that many days have seemed like a dark time, especially when you have worked long hours, are in constant demand, and there's no light to be seen. However, you all have been the light. You've been the light to many families, to many patients, to many other individuals. Words really cannot express our gratitude and appreciation for your work and what you've demonstrated beyond the walls of our structures. So thank you all again for your contributions to your patients, to us, but most importantly, thank you for serving our communities as a whole. And just on a personal note, I want to say thank you because healthcare heroes for me, when I was 20 years old and I was diagnosed with an autoimmune illness, you were the ones that made me feel like a human being. So I just want to say thank you. I am not surprised by you stepping up during this time because you stepped up for me all that time ago. But it is an honor truly to tell you thank you this evening. With that, I say congratulations